Subaru.com and on Facebook at Tyndall Subaru.
This is Charlotte Talks. I'm Mike Collins. Mask mandates have been falling around the country. 11 states and the District of Columbia have eliminated the mandates, and now Mecklenburg County joins that movement. Last night, the County Commission voted unanimously to end the requirement effective February 26th. That's next weekend. The vote came following the recommendation from the county's new public health director, Dr. Raynard Washington, and he joins us now. Good morning. Welcome.
Good morning.
This is the first chance we've had to meet or talk since Gibby Harris retired at the end of the year as our public health director. Thank you for being here. And this is a baptism of fire this morning because this is a controversial decision that came
It certainly is
last night. So thanks for being with us. Let us start with your recommendation and the county commission's vote last night unanimously to rid ourselves of indoor mask requirements beginning on February 26th. With more than 175,000 people catching this virus every day and with more than 2,200 people dying from COVID every day around the country, why is now the time?
Yeah, so certainly, our conditions here locally and across the state have improved significantly over the course of the last several weeks and months. We certainly saw the worst surge that we've experienced across the country, and again here locally with the Omicron surge, the Omicron variant. And so those conditions have improved markedly. Our case rates are down by nearly 90% from the peak, as well as our hospitalizations have declined roughly 50%. And the conditions on the ground here have greatly improved. At the same time, we've also had a changing landscape relative to the metrics that we use or rely upon to help us understand what's happening with the pandemic. Specifically, I think, as you are aware, the mask mandate was tied to our percent positivity solely. That metric has unfortunately become more unreliable over time because of the fact that we as public health agencies simply aren't doing a good job or will not be able to do as good of a job counting cases because of the availability of rapid at-home test kits and also because of the challenges people experience with accessing testing. And people who have mild cases or more asymptomatic illness are very unlikely to go get tested, and that changing landscape certainly impacts the reliability of that metric.
Let me ask you about that then, because for almost 2 years now, since whenever the mask mandate went up, the health officials at the county health department said when positivity rates hit 5%, we can lower these mandates. The last I knew about, they were at 14.5 to 15%. And you're saying that number is unreliable, which means it could be lower, but it could also be a lot higher. It probably would be a lot higher if people are testing at home and not reporting or are asymptomatic and don't know that they have COVID. So why, in that light, are we going against what we said from the very beginning?
Certainly. And I think one of the important points that I was also going to make relative to why now is that we certainly have a greater level of immunity across our community because of the vaccination rates that we have here. Roughly 62% of our residents have been fully vaccinated. A large proportion have also received their booster. And because of the greater transmissibility of the Omicron variant, we've had a lot more people experience infections in the last several weeks and months in our community. And so there is a level of immunity that's been built up because of those factors that I think leads us to our decision to begin this transition, not just from the mask mandate, but also several other of our key response components, including contact tracing and case investigation as well.
Are you certain that there's a higher level of immunity, or is that wishful thinking in any way? I don't mean to be flippant about this, but seriously, I mean, are you certain, as from a medical point of view, that is the case?
Sure. We've said since the beginning we've always undercounted cases in the community, and given the number of cases we actually were able to count during the Omicron surge over the course of the last 6 to 8 weeks, I'm confident that there are a lot of folks in our community who do have a level of protection that will prevent them from being able to develop another infection for at least some period of time. I don't have a crystal ball, and COVID is still spreading and it's still mutating. And so certainly there is a high propensity or a likelihood that we will see new variants in the months to come. And those variants may behave differently. They may not behave, they may have milder infections, they may have more severe infections, they may be more transmissible or less transmissible. I frankly don't know what that will look like in the future, but we do have to be prepared for when that happens. And we've got to talk frankly with the community about what being prepared looks like, because it will take individuals being empowered to act when that time comes.
There have been states all through this that have never had mask mandates. 11 states have eliminated them as of this morning, plus the District of Columbia, and municipalities around the country also have been doing something similar, like Mecklenburg County. And NBC's Lester Holt on that network's Nightly News got President Biden's take on this rush around the country to end mask mandates.
Are you afraid, though, that some states and cities are moving too quickly to loosen indoor mask mandates?
Well, you know, it's I committed that I would follow the science as put forward by the CDC and the federal people, and I think it's probably premature, but it's a tough call.
So the president says he reached a conclusion that dropping masks is premature because, quote, he is following the science. Are you?
Yeah, am I following the science? Is that the question?
Yes.
Absolutely, yeah. So I believe that it's clear to all of us in public health, and this.
One of you is wrong.
I don't believe so. I mean, science exists on a spectrum, to be very clear. I think this was a part of the discussion last night. You know, our learning and understanding with the pandemic all along has evolved over time. Certainly, we have been put in a position to where we had to face COVID, that we didn't know what it was, and the science has evolved over time. How we respond as well has also evolved over time. The metrics, the tools that we use, the tools that we have available have also evolved. And I believe that this evolution will continue to happen, not just here locally, but again, across the state and across the country.
And it's true, you're right. The science has evolved over time because we're dealing with something we've never dealt with before, at least in most people's living memory, and a virus that we've never dealt with before. And as we learn, scientists come out with different pronouncements about how it reacts and what we should do in the face of it. And that's all difficult to understand and yet understandable at the same time. But it also seems that things change from jurisdiction to jurisdiction, that they can't be following the same science if things are being reacted to in different ways. And the CDC says right now that everyone, vaccinated or not, should wear a mask in indoor public spaces in areas of high transmission. And as of today, those areas comprise 96.4% of counties in the country. Would that include Mecklenburg? And if so, why are we ignoring that advice?
Certainly, it does include Mecklenburg and actually every county in the state of North Carolina. And we are continuing our efforts to ensure that we recommend individuals to wear a mask consistent with that guidance. We lifted the mandate, but we did not encourage people or discourage people from wearing masks, particularly those who are more vulnerable in our community. Again, I do expect, I've seen some indication that the CDC director will be sharing new updates relative to that guidance in the next several days as they work through their processes to understand what that looks like and be prepared to present that to the community.
So the mask mandate falls on February 26th, and you're giving it 10 days because that's the law. You have to give people 10 days to react. I'm not exactly sure why, because it's never been enforced fully here anyway. But that just is in public spaces like grocery stores and movie theaters and bars and restaurants while you're standing. You can always take it off while you're eating. But schools will continue to have control over whether they require masking, but you are recommending that K through 12 and childcare providers establish plans to transition to mask optional status by early March. There are parents who have never wanted masks in schools. There are parents who want to keep masks in schools. Why not leave this decision, or are you leaving this decision up to schools?
Certainly, this decision is wholly up to the school district for public schools as well as each individual school. They have been asked to follow guidance by the State Department of Public Instruction that's issued by the Department of Health and Human Services, which still encourages them to implement or enforce universal masking in those settings. Let me also clarify one thing. It's not just schools, but every entity can choose to still enforce mask requirements in their space. So bars, restaurants, movie theaters, any kind of venue can in fact continue to require masks to be worn once the mask mandate goes away. And that is a reality that's existed throughout the entire pandemic. My advice or guidance to the school district specifically, though, has been to prepare, as I do expect, again, with changing guidance, as well as with the rate at which we're declining, our rates are declining currently, even with the CDC's current metrics. I believe that we'll reach that point in early March. And so the school district should be prepared. They have to communicate to the 150,000 families that they serve, as well as their staff, over the course of the next several weeks, what that plan looks like. Alongside that implementation, they also have to work to implement the removal of contact tracing, as well as the exclusion criteria that was released that goes into effect on Monday of next week. And that also is a process and takes a lot of communication and training of staff and other individuals to ensure that the off-ramp for that implementation goes successfully. And so I think shifting to mask optional will probably be the next big step for them, or the next big transition. So it's important that they start to make those plans now. And the Board of Education actually has the authority, though, to make the decision about when they actually lift the requirement for masks in their settings.
WBTV reported last night that the commissioners took their vote after hearing heated discussions about all of this from the public. And we've also witnessed heated mask discussions at school board meetings here and around the country. Should we follow the science, or should we follow a public opinion when it comes to mask mandates and COVID?
Certainly, our decision making here at the department and my considerations are based on public health practice and science. It's not based on the quote unquote public opinion. There's a lot of opinions about a lot of things relative to COVID. You can Google COVID and see there are tons of opinion pieces that some people often even cite as fact available on the internet and the web, which has been one of the greatest challenges we've had throughout the pandemic, is trying to sort of make sure that we are managing through the misinformation that's available to folks in the community. We continue to follow what we believe to be best practice. As you alluded to earlier, the mask mandate, we have not taken any enforcement action since it was first implemented back in September. And so my decision-making about the conditions on the ground here in the community, the conditions in our community relative to immunity, as well as where I believe we're headed in the next several weeks related to our overall transition in terms of how we're responding, were the driving factors in my decision-making for my recommendations last evening.
More than a few politicians, and some have said this from the start, that we have to learn to live with this disease. And in fact, last night, Democratic Commissioner Susan Rodriguez McDowell said that we need to learn how to live with this. That's a quote. But enough people are still dying from COVID that there's so many, in fact, every day who die from this, that if they had died in plane crashes around the country, we would ground the entire fleet. So why isn't wearing a mask a reasonable trade-off?
So I'll still wear my mask, and I encourage folks to do that, certainly. And I think it is, I believe it's the right thing to do. I recognize that folks have to make personal decisions about what they're comfortable with and what they're able to do. And I also recognize, though, that there are some in our community who are incredibly vulnerable. They have medical conditions, they're immunocompromised, and I totally empathize with those individuals because this does have implications. If people stop wearing masks, they will be fearful to go out of their house and go into out of their homes and to go into the public setting. So certainly we're working to make sure that those individuals have access to the resources and tools that they can use to protect themselves as much as possible, and make sure that is available to them.
Talk more about that when we come back with Dr. Raynard Washington in just a moment. Support for Charlotte Talks comes from WFAE members and Jaguar Land Rover Charlotte, introducing the newly combined Jaguar Land Rover Charlotte facility, now open at 6710 East Independence Boulevard in Charlotte. Details at jaguarlandrovercharlotte.com. It's Friday tomorrow. That means tomorrow morning on this program at 9, the local news roundup, mask mandates that we're talking about right now, falling around the country, falling here in Mecklenburg County. Scientists have feared that deer may be a COVID carrier, passing the virus on to humans, and the virus has been found in deer here. We'll talk about what that might mean. The head of the mayor's racial equity initiative steps down, but questions still swirl around the project itself, and state Republicans released the first redraw of congressional maps with some help from Democrats, believe it or not. Those stories and more with our roundtable of reporters tomorrow on this program at 9.
WFAE invites you to a special live event Tuesday, March 8th. Charlotte Mayor Vi Lyles and others will join Charlotte Talks host Mike Collins for Equilibrium, a candid conversation about race and equity. And on February 28th, we'll hope you'll join us for a special virtual announcement about our race and equity team. Details and registration for both events at WFAE.org. Major support for WFAE's race and equity team comes from Wells Fargo.
It's Charlotte Talks on listener-funded 90.7 WFAE and 90.3 WFHE. I'm Mike Collins. We're talking about the County Commission's decision at the recommendation of our new Public Health Director, Dr. Raynard Washington, to drop the mask mandate in Mecklenburg County as of February 26, which is next weekend. And Dr. Washington is with us. Some people, including myself, find all of this very confusing. I mean, all these, there are lots of mixed messages and a lot of rationale swirling around all of these things that make it very difficult to understand what the heck it is we're supposed to do and why we're supposed to do it and what we've done in the past and why we did it. Before your decision to recommend these masks fall, Dr. Katie Passaretti, infectious disease expert at Atrium Health, said, the steady decrease in cases and hospitalizations do point to a mask mandate recension as the next natural step. And almost in the same breath, she was also advising people at highest risk for COVID complications to remain cautious, deferring to the health department, about what to do. What are the proper precautions for those people? Are we putting them at more serious risk for COVID? And do we not have a moral responsibility to protect the weakest among us?
Absolutely. So, in public health, our number one mission here is to promote and protect health. And so that is certainly important and a part of the work that we do every single day. To be clear, the things people should be doing right now are no different than what they were before yesterday. People should get up to date on their vaccines relative to COVID, their initial doses if they have not received those, a booster dose if they have not received that. If they're sick, they should certainly stay home and not risk the potentially spreading some respiratory virus, COVID or something else, to other individuals. If you are medically fragile, vulnerable in any way, if you have and are concerned about the risk of developing a COVID infection that might be severe, certainly it's important for you to protect yourself. And I believe wearing a high quality medical grade mask when you go into risky indoor public settings is really important, particularly those where you can't social distance and you can't keep your distance from other people. Testing also remains really important for individuals to know when they have an infection so that they can make decisions, they can self-isolate, they can inform their close contacts, and they can know that I have a COVID infection. And if they are medically fragile and have COVID, they can seek treatment early. That is the best course of action to make sure that they avoid a hospitalization and seek treatment in the community as quickly as possible.
Confusing this issue even further, and particularly for me, and maybe it's only me, I don't know. Last night you said that this is not getting rid of the masks. This is getting rid of the mandate. Now, even when we had the mandate, there were people out there who would not wear a mask. And because it wasn't enforced, sometimes they weren't asked to leave an establishment. Sometimes they were allowed to stay. Sometimes they weren't. If this is the right move to make, doesn't that mean that we never needed to wear masks at all? Has all this been like taking off our shoes or searching grandmothers at the airport, just theater to make us feel safer?
No, so I think the science is clear that masks are effective. Masks reduce the risk of transmission. If somebody in a space has an active infection of COVID or some other respiratory illness, and there are different levels of protection relative to the type of mask that you're using. So I think the masks are effective. They do offer protection. I think we've been using masks in this country for several centuries. It's not a new thing for people to wear a mask. If you go into a hospital setting or a surgery room, you see masks there for that very reason. And this is about our response. This is about how we as a community manage our response to COVID, which is still important. As you mentioned earlier, it's killing people in our country every single day. And we have to have a formidable response to it. But this particular tactic or strategy is what we're recommending to move forward from.
If those who are most at risk for contracting this and being affected by this disease, the immunocompromised, young children under 5 who cannot get the vaccines at this point, if they are most at risk, are they more at risk in a world in which people do not have to wear masks, but they can wear masks to protect themselves? Or would they be less at risk if we all wore them?
Certainly, I believe the risk of transmission, if there were 100% mask compliance, is certainly lower significantly in a community or a space
Then isn't that worth it?
I'm sorry?
Then isn't that worth it?
Uh,
Making everybody wear a mask until.
I'm sorry. For the vulnerable, you mean?
Yeah.
Yeah. So, I mean, we continue to encourage that, Mike. This is about if we are going to use a Board of Health policy to achieve that goal. A policy
But isn't that the responsibility of a Board of Health?
It certainly is. Yeah, it is certainly the responsibility for the Board of Health to protect the health of this community.
Are we protecting the health of this community by lowering the mask mandate at this point in time?
Yes. I mean, I believe we have, again, it's not just about the mask mandate, Mike. It's about having those tools and resources available to everyone, which we have not had for the last 2 years, and making those tools available to everyone in our community so that they can make the right decision to protect themselves.
The push to lower masks is happening around the country, and as it happens, it will pick up speed. You can bet your bottom dollar on that. Denmark was the first major country to lift all of its COVID restrictions, declaring the pandemic over. The prime minister there said, "We dare to believe that we are now through the critical phase." That was at the beginning of this month, 17 days ago. Well, it turns out that belief is not science, because today they are recording more COVID cases per capita than anywhere in the world, and both COVID hospitalizations and deaths have shot up by a third. They're now 67% of peak and growing. When you hear that, what goes through your mind?
Sure. So I follow that very closely, and I know that announcement was made very early on in their Omicron surge there in that community. And so certainly I do think I'm confident we're on the other side of our surge, and don't anticipate that will happen in our community. Again, I don't also have a crystal ball, and so I can't say with complete confidence that there won't be a new variant in the next several months or weeks. I don't know what that will look like, but certainly I do know that our conditions at the time of this action being taken is very different than at the time at which that was taken there.
So if trends reverse, right now they're going down by all accounts. They're still above what we've been saying for almost 2 years. They should be before we take the masks down, but we're saying, okay, we're going to do it anyway. But if trends start to go up, are you likely to reinstitute a mask mandate or other restrictions, or is that done with now forevermore?
As I said last night, there certainly is always the likelihood that we in the future may need to institute additional community mitigation measures to help us respond to the conditions as they emerge or evolve on the ground. I don't know what the future holds, as I've said previously, but if conditions particularly related to severity of impact on our community, if our hospitals are starting to fill up, if we see an emergence of a variant that causes more severe illness that spreads more rapidly, we may need to reinstitute mitigation measures across the community, or in some way, shape, form, or fashion, either via Board of Health rule, public health advisories. That is certainly, there needs to be the expectation that we may need to do that. If it's COVID or some other virus that's spreading in the community, we will need to take action as needed in the future. And that certainly is very possible.
Dr. Raynard Washington, I promised to let you go at 9:30. It's 9:30, so I'm going to let you go, but I thank you for joining us and hope
Yeah.
you'll come back. We'll talk some more about your job and your hopes for the job in the
Absolutely. I
future,
look forward to it. Thank you.
outside of COVID. Dr. Raynard Washington, Health Director of the Mecklenburg County. Thank you for being here. Let's continue with our conversation about COVID and about the conflicting guidance that we seem to be getting from various health experts and institutions like the CDC, and how we should use that guidance to live in a world where the virus remains, but masks are dropping and social distancing is disappearing. Claire Donnelly is WFAE's healthcare reporter. She's with us, and we're joined also by Apurva Mandavili, a reporter for the New York Times, focusing on science and global health. Welcome to you both. Good morning.
Good morning.
Morning. Thanks for having me.
You're welcome. Claire, what has been the reaction, if you know, to the county commission's decision and the decision by Dr. Washington to drop the mask mandate?
Sure. So we should say first that the county commission meeting last night was certainly tense. There was a really big crowd, mostly parents, who were there to protest the mask mandate and encourage commissioners to vote to drop it. So they had signs, there was some heckling going on, some interrupting when commissioners were speaking. I would say the reaction is mixed.
Excuse me, on both, the heckling on both sides or one side in particular?
Oh, no. So I would say the majority of folks, the majority of people at the meeting were there to encourage commissioners to drop the mask mandate.
Okay.
There were a couple of speakers, both virtually and in person, who were there to advocate for keeping it. But I would say reaction was mixed, just like so many things during this pandemic. It's really political and it's really personal, and there's strong feelings on all sides of the problem. So, yeah. Some people are scared. There was a woman who spoke who expressed concern. She said she has 2 immunocompromised children and was worried about what dropping the mask mandate would do. And then there were also, people, including a high school student, who said that having to wear masks, has been really frustrating and hard because you can't see people's faces. So.
Apurva, you cover global health for the New York Times. From what you know, how would you compare the approach to COVID that we've taken in this country to other countries, and to whatever nation you believe has done the best job of maintaining or keeping the virus at bay?
It's been a very mixed bag across the world. I think some countries did very well through 2020 and even part of 2021. And then they were sort of floored by Delta or Omicron. And we've sort of never really done a good job here in this country. And part of that, I think, is because of the reluctance to wear masks. I've been listening to your conversation with the others, and, I think all of these conversations would be different if people were actually willing to wear a mask. And that's not just here, in America, but in many parts of the world. I think the only part of the world where people have been pretty comfortable wearing masks and there hasn't been as much public resistance has been in Asia, where there's a long history and tradition of wearing masks, for allergies and for other infectious diseases. But in most countries, in Europe and in the US, where this is a new thing, masks have become, as you know, this contentious point of, individual freedom. So I think all of these conversations that we're having, about are we following the science, to me, it seems a little bit like they're moot because people are not willing to really continue with mask mandates in most of this country.
Is it a cultural difference in Asia? Is it a political difference in Asia? Is it simply because they have had bad bouts of air pollution in Asia or outbreaks of airborne diseases that they're just accustomed to doing this automatically when times require it? What's the difference? Is it simply that we have this me attitude, that I'm free to do what I want to attitude?
I think that's part of it. All of those actually contribute. There's a cultural factor. There's because of the allergies, as I mentioned, and pollution. But there's also, some of those countries have more authoritarian governments that enforce these mask mandates a little bit more strictly than we have. And there's also just the sense of public health. I think the one thing that's been really, really striking about our response in the United States is this conversation about individual freedoms, because public health is never about individual freedom. It's about what's good for the community. And I think this is not a case where, you know, we've shown ourselves to really care about the community around us. It has become very much about what's good for me, what's good for my child, rather than what is, you know, what is inconvenient for me, what may not be great for me, but what is good for the whole community. So I think that has been a very different path, but I'm not sure that we could have really made that switch that quickly, because this isn't something we've talked about a lot in this country. I mean, these are all things that were true of flu, and we didn't do a great job of convincing people to get vaccinated for flu. So we probably should have been expecting not to do very well for COVID.
Claire, did you want to comment?
I just wanted to jump in to say, you know, the other thing is that public health officials have the really tough job all the time of changing behavior. And that is, you know, possibly the hardest thing to do, is to tell somebody, I know this is how you've been doing it all along, but now we're recommending you do this instead. And that's never easy, whether it's wearing a mask or, you know, if you're opposed to vaccines, getting a vaccine. That's just a tough job no matter what.
I absolutely agree. I think we needed to sort of start a lot sooner so that we were ready for this point in time.
There has been pressure from individuals, and this is a political decision in some part, in part a political decision. And I know that from the beginning, many businesses were opposed to a lot of these restrictions because they were afraid it would hurt business. Claire, are businesses, or any particular types of businesses, worried that lowering the mask mandate might also negatively impact business, that customers might be fearful of going to that business because it's a movie theater with a lot of people in it, or it's a grocery store with a lot of people in it, or some other environment where a lot of people gather unmasked? Could that help or hurt business? And are there concerns about that?
I'm not sure about businesses specifically, whether they're worried it would hurt their business. I will say, you know, anecdotally, there have certainly been places that, despite having a sign on the door saying mask is required, you know, no mask, no service, we've all obviously seen places where that still happens, because it puts, from the get-go, you know, mandate or no mandate, masks have put businesses in a really tough spot. At the business level, the owner is having to make a decision, or maybe the clerk or the grocery store cashier, of, you know, am I going to go through the rigmarole of asking someone to put on a mask who may not want to? And sometimes the path of least resistance is to just, you know, serve them regardless.
There's no question that everybody is tired of COVID. They're tired of mask wearing. They're tired of us talking about all of this. They want life back to normal as quickly as possible. But we did a program last week with two scientists who said essentially that we are not going back to normal, even if this virus reaches the endemic stage. And one said this virus will be with us forever, and we have no idea what happens next. From what you're hearing, Apurva, what does this mean? Are we at a stage here now where we're just willing to roll the dice on this because we're tired of it?
It definitely seems that way. I mean, I think those experts you talked to are right. That's actually what I'm hearing from the people I talk to as well. You know, we are not at the end of this pandemic. And even when we are at the end of this pandemic, we will be endemic. We will be living with this virus for a really long time. And that doesn't necessarily mean that the number of cases or the number of hospitalizations will go down. It just means that the virus will become sort of a permanent part of our lives and have these flare-ups. You know, measles is endemic in many parts of Africa, and TB is endemic in a lot of parts of the world. And TB killed 1.5 million people last year. So you know, this idea that once we start to live with this virus, that we're not going to see a lot of deaths is a myth. So I think we have to sort of strap in for the long haul.
We're coming
here.
right back in a second. Keep up with arts news in our community by subscribing to WFAE's Tapestry. That's a weekly arts and entertainment newsletter. Subscribe to Tapestry at WFAE.org/newsletters. Coming up in 20 minutes at 10 o'clock on 1A. How much should you trust cryptocurrency? whether online or on TV. Digital coins and currencies have gone mainstream. Celebrities like Matt Damon and Larry David are part of the big ad blitz that's all about FOMO. Well, on the next 1A in 20 minutes, you'll find out if you are missing out and what you might be missing out on. This should be interesting. That's coming up right after this program. We will continue to talk about masking restrictions here and around the country and the state of the COVID pandemic, which may be becoming endemic, in a moment. Stay with us.
Hi, I'm Mary Louise Kelly. What do your afternoons look like? Wherever you are, whatever you're doing, All Things Considered from NPR News is there. You can catch up while working out, hear a mix of news and stories while mixing up dinner, and you can travel the world with stories that take you there, even if you are stuck in traffic. All Things Considered. Listen every afternoon.
Tune in weekdays from 4 to 6:30 on 90.7 WFAE.
It's Charlotte Talks on WFAE and WFHE. I'm Mike Collins. We're talking about the lowering of the mask mandate as of February 26th, of a decision last night by the Mecklenburg County Commission, affecting Mecklenburg County only, and recommended by our county health director, Dr. Raynard Washington. We're joined by Claire Donnelly, who's not a doctor, but may
You could
soon
make
be.
me a doctor.
Healthcare
Honorary
reporter here,
doctor.
healthcare reporter for WFAE News, and Apurva Mandavili, a reporter and for science and global health for the New York Times. I want to follow up, Apurva, with the answer that I had to interrupt you on a moment ago about whether people are just willing to roll the dice now because they're tired of all of this. The United States has lost well over 900,000 people to COVID in the last couple of years. The death toll in around the globe is in the millions, and according to the scientists we spoke with on this program last week, endemicity, when the virus becomes an endemic, a kind of low-level hum in the background, that says nothing about the total number of infected people that we'll see at any given time or how much death or disability the virus might cause, and it certainly, they said, does not promise a return to life as we knew it in 2019. Is that something that most of the people in the world, both the people and policymakers and health officials, know and understand, and they're just willing to take the mask off and take their chances?
I don't think people are really aware of that. I don't know if they're lying to themselves or they really truly don't understand what these experts have been saying, or they're tuning them out. But I think people really want to believe and do believe that we are towards the end of this pandemic and that Omicron is sort of the last bad variant that we'll have to deal with. There are lots of people who are out there are saying that this is it, this is the worst of it. And from now on, even if people get infected, they're not going to get very sick, so we'll be fine. I don't think that will be the case, at least, might be the case for a year or two, but certainly not in the long run, because this virus will keep mutating. But I don't think people want to think about that or even hear that right now.
Well,
Just to add on,
Go ahead.
I just wanted to say, just to add on to that, I think, some of that is also when we talk about endemic, I'm frustrated sometimes hearing people say, when will it be endemic? When will it be endemic? There's not going to be sort of this bolt of lightning where everyone is suddenly like, ta-da, it's endemic. It's going to be more like what Dr. Washington was talking about earlier, where we slowly adjust our response and our behavior, and just, we're going to look around in 2 or 3 years and say, oh, look, we're dealing with this virus as an endemic virus.
And again, to bring up the quote from the Prime Minister of Denmark, who said that not too long ago, like 17 days ago, that we dare to believe that we are now through the critical phase. Belief is not science. And they're experiencing, now that they've rolled back all of their precautions in Denmark, they're experiencing a meteoric rise in cases. And just, Apurva, as these mask mandates began to fall in states around the country, the government has delayed the rollout of vaccines for children under 5. Prior to that decision to delay the rollout, you reported that interim trial results suggested that even 2 doses of the Pfizer vaccine did not produce a strong immune response in children aged 2 through 4. Do they have a theory as to why, and is that why they have delayed the rollout?
That is why they have delayed the rollout. So in those results that Pfizer reported, it was in December, and they said that the vaccine seemed to work okay for 6 months to 2 years, but not 2 to 4. And that's probably because the dosage was too low. So, adults got 30 micrograms of the vaccine. Kids 5 through 11 got 10, and these young kids were given 3 micrograms. And it's possible that that dose was enough for the really little kids, the 6 months to 2 years, but not quite enough for the 2 to 4s to produce a strong immune response. And so that was based on sort of just antibody levels. And then, Omicron came along, and a lot of kids in those trials did get infected. So at first they thought, oh, actually the vaccines are working okay based on these infection numbers, which is why the FDA thought, oh, we'll review this early. But then more data came through, sort of confirming what the trial had shown, which is probably that this dosage is not enough, at least at 2 doses, and they may need to have a third to get the immunity up high enough to combat the virus.
Can it be said that these decisions around the country to lower mask mandates at a time when they have delayed the rollout of the vaccines to young children whose only protection really is masking, that we are putting our comfort ahead of the health and safety of children? Is that an unfair statement, or is that a fair statement?
Like everything else about this pandemic, I don't think it's clear one way or the other. I think that the truth lies somewhere in the middle. I think we are being somewhat unfair, but I think we also have to remember this has been a pandemic of trade-offs. I mean, people are not willing to give up all of their freedoms. And maybe this is what this is just a break. If we are willing, what ideally would happen is that we would put the masks back on when the numbers came up. I'm not sure that that can happen. Maybe the genie's out of the bottle, but ideally that's what we would do, because at this moment in time, in a lot of parts of the country, the risks to kids are probably very low, but that won't necessarily stay that way. And it isn't necessarily the case for kids who are, immunocompromised or have people at home who are immunocompromised. So it's certainly unfair to them. One thing that's different though now than it was in 2020 is that we have these N95 masks that we didn't have really access to back then. And if people can wear N95 masks, it will at least keep them protected some of the time, probably most of the time. And so gives them some protection and not leaving them completely vulnerable to what other people around them are doing.
Larry, yesterday, the Commonwealth of Virginia, just to our north, banned mask mandates in schools. This means that parents can still allow their child in Virginia to wear a mask, but schools cannot that they do so. And at the signing ceremony for that bill yesterday, Virginia's new Republican Governor Glenn Youngkin said that this mandate was a way of, quote, reestablishing and restoring power back to parents. But he added, we are also reestablishing our expectations that we will get back to normal. Well, there's a risk to everything. And we all do risk analyses of everything that we do, whether we know about it or it's just a subconscious thing. Have we now decided that this is another example of a risk worth taking? Is that what this is really all about?
I think it's important to point out, the difference between a mandate and mask optional. So actually right now, Charlotte Mecklenburg Schools is the only district in the Charlotte area that is not mask optional. So in all of the other surrounding districts, parents can opt to have their child wear a mask or not wear a mask. So as Dr. Washington was saying earlier, we're not getting rid of masks. We're not going to stop recommending masks. We're just saying you're not required to wear a mask. I know actually Governor Roy Cooper is supposed to hold a press conference later today, I think at 3, and going to make an announcement related to schools and masks. So it'll be interesting to see what that is. I don't think he's likely to ban mask mandates in school districts. That wouldn't really be consistent with what he's done thus far, but he may relax, whether they continue to recommend masks. And then also, the CMS school board is meeting next week, and Dr. Washington is going to be presenting at that. It would be consistent if he recommended, that they not continue to mandate masks.
Prior to yesterday's signing in Virginia of a ban on mask mandates in that state's schools, one parent told NBC News that she feels for parents whose children are immunocompromised or who have conditions that make them susceptible to respiratory viruses like COVID. But she said that this is not the first respiratory virus that we've dealt with, and the others did not require people to wear masks. But isn't this one more lethal than the other respiratory viruses? Are we failing to connect the dots here?
Absolutely. This is something we hear a lot, people comparing it to the flu. Well, we don't shut down schools for flu. We don't have lockdowns. We don't wear masks, et cetera. But we also don't lose, 900,000 people to the flu. So it's a really flawed comparison. It's true that the vast majority of kids are probably not at high risk of, COVID, but there are a lot of kids with conditions that would predispose them. Their obesity, diabetes, lots of immune conditions, and it's not always clear which of those conditions is going to cause a risk. And there are some that maybe the kids don't know about, the parents don't know about. There are in the last sort of wave, in the Omicron surge, there were more kids 0 to 4 in hospitals than there ever have been throughout the pandemic. And if you look at those curves, it was crazy. I mean, they went just really almost straight up to a very high number. So, it's, I think people really want to believe that this is trivial, but it's obviously not. It's really just more a question of whether people want to acknowledge that to themselves and be willing to give up something. And I think what we're seeing is that they're not.
Of course, here from the New York Times, that liberal rag, and we're sitting here on an NPR station, that liberal media outlet, and the people who are watching Fox know nothing about this, and they have a completely diametrically opposed attitude toward that. Is that because they're being fed a line of bull, or what? Or are we full of it?
I mean, they would say that, right? So I think, it really depends on what people have been hearing. I think, on Fox News, there have been a lot of anti-vaccine messages since vaccines were rolled out. And there has been a lot of conversation about the pandemic being sort of blown out of proportion and the virus not being as dangerous as it's being made to be. There are a lot of liberals who believe that too. And there are a lot of liberals who are really opposed to mask wearing in schools as well. I think we are actually at this interesting point in the pandemic now where things don't necessarily just fall by political lines. They do, to a certain extent, but this is the first time that I'm actually hearing a lot of public health experts who would normally be very clearly on the side of precautions say, why don't we start dropping them? Maybe we need a break. Maybe, we should just not do it now.
How much of that is due to political pressure, even among Democrats? Because this is a midterm election year. And if Democrats know that people are sick, even liberals are sick of COVID and sick of mask wearing and sick of restrictions, maybe they want to go into the midterms with fewer restrictions. And so they're pressuring their public health officials to lower those restrictions. How much of this is politically motivated from both sides, despite the science?
I mean, the midterms definitely have a huge part to play here. And I think that's especially true for all these Democratic governors who've been very sort of willing and eager to roll back the precautions. But, I'm also talking about public health experts who, as far as I know anyway, are not politically affiliated. And many of them are surprisingly, supportive of the rollback of precautions. Many of them are not and think this is a terrible idea and this is the wrong time for us to be relaxing, that we're not quite there yet. But it's definitely louder than I've ever heard it be, that maybe it's okay to stop wearing masks in indoor spaces. Schools, especially, I think, because they feel, kids are at not high risk. But again, as we've said, that's a matter of perspective also.
Claire, this is a democratically controlled county, a democratically controlled city. A democratically controlled county commission made that decision last night to drop the masks. What does that tell you?
Well, I just wanted to say that it was really interesting to watch because you could see that there was some, hesitance among some of the commissioners because they realized that, by voting to drop the mandate, they were going to be, in some ways, aligning themselves with some of the protesters who were there sort of beating the drum to get rid of masks and have done so since the beginning. I will say we have heard more and more recently from scientists, from health experts who are calling into question, how long are we going to continue to live with some of these precautions? And so I think that was a weird line for them to walk. I will also say that the commission chair, George Dunlap, briefly asked if it would be possible to, instead of rescinding the mask mandate, adjust the public health rule to say masks are optional in the county. But then because of the various, time delays and bureaucracy involved in doing that, ended up rescinding that suggestion. But I think it's tough because you could tell that they were frustrated with the way that some of the protesters were comporting themselves. And as you say, as Democrats, not necessarily wanting to align themselves with the folks who have been anti-mask from the beginning.
I got to tell you, we know for a fact that a lot of people are confused about these conflicting messages. I'm confused, not just about what to do next or how to act, but why we're going through all this confusion. It makes no damn sense to me. But a recent Pew Research poll shows that a majority of Americans, 60%, have perceived or believed changes to public health guidance on curbing COVID transmission have been confusing. And the CDC and other health institutions have repeatedly come under scrutiny for mixed messaging. Only 50% of Americans say public health officials like those at the CDC have done an excellent or good job on COVID. And that's down from 60% in August. Why did this happen this way? Did other countries struggle with messaging from their health organizations? And I have 20 seconds. Apurva.
I don't think they did. Japan did a fabulous job. South Korea did a fabulous job. I think that there's something been going on with our CDC that has been a huge mess since the very beginning of this pandemic. I'm not sure we've recovered from that quite yet.
Could this confusion have been avoided? Would it have been avoided under a different administration at the very beginning of this pandemic?
I don't think so, because we're seeing the same sort of confusion now with the Biden administration. I think a lot of it has to do with the CDC normally being very slow and very sort of having a tough time acknowledging political and societal realities, and then not sort of knowing how to balance the two.
But we'll watch what happens as we go through the next several months. Apurva Mandavili, a reporter on science and global health for the New York Times, Claire Donnelly, our healthcare reporter at WFAE News, and earlier, Dr. Raynard, Washington Health Director for Mecklenburg County.
Charlotte Talks with Mike Collins is a production of 90.7 WFAE. Support for Charlotte Talks comes from Mazda of South Charlotte. Our executive producer is Wendy Herkey. The senior producer is Erin Keever. Our producers are Gabe Altieri and Jesse Steinmetz. Our engineer is Joby Sprinkle. For more information about Charlotte Talks, go to wfae.org/Charlotte Talks.
Hey y'all, this is Tommy Tomlinson. This week on the Southbound Podcast, we're re-airing a 2020 conversation I had with LaTreya Graham, a South Carolina writer who grew up on her family farm and speaks with deep passion about the experience of Black Americans in the great outdoors. You can find this and every episode of Southbound on Apple Podcasts, NPR One, and WFAE.org.
Well, tomorrow on this program, it's the local news roundup because it's Friday at 9, and our roundtable of reporters will be joining us to talk about the